So my name is Amanda. I'm 48, and I was diagnosed with adult onset asthma when I was 29. I've had asthma for about 19 years. I was diagnosed at age 29 during dental school, and at first I was treated for bronchitis, and then after the bronchitis cleared up, I still had residual symptoms. And so then I was diagnosed with asthma, and then subsequent to that with chronic sinusitis. The sinusitis diagnosis came soon after the asthma diagnosis. And initially, because I was in dental school and I was not insured, it was just sort of treating flare-ups. So I didn't really have any stable, consistent treatment. I had a military scholarship, so when I went to the Army, that's when more consistent treatment began. But even so, it was mainly control meds and a lot of prednisone. And that was for about 4 years until I got out of the Army. With the prednisone weight gain, I would feel when I was on the steroids, I obviously had more energy and was able to get more done. And then, it was extreme. Like when I would come off of it, then I was exhausted all the time. So I didn't mind being on them because it helped me feel better. But, long term, I knew it wasn't good. In fact, the eye doctor saw like early stage of, I think, cataracts, which he said is a common side effect of long-term prednisone use. I mean, I would say the worst of it was the extreme, like the difference between being on it and not being on it. Currently, my asthma is controlled. I've been on Fasenra, which is a biologic, for about a year now. In addition to the Fasenra, I'm on Asthmanex, Symbicort, Flonase. I also use a budesonide nasal rinse, albuterol when I need it. And currently I'm on a low dose of prednisone because I am having sinus surgery. So they just want to keep me stable until then. Prior to the Fasenra, I was on Nucala for, I want to say maybe 3 years, and it worked really well until it stopped. Like it seemed like I plateaued, and then I would have more flare-ups, and I was using prednisone. Like when I was on it and it was working, I didn't need prednisone at all. And then I had several flare-ups, and at that point, my doctor decided we should try a different biologic. And Fasenra has been working great. It's just that the polyps have recurred, and I've been having like sinus issues. So that's why we're, looking at surgery. I think my best advice would be to advocate for yourself. For a long time, I didn't do that very well. I didn't want to ruffle feathers or, make a stink. But if you're feeling unwell, you need to tell someone. And I also think with some of the medications, if you're experiencing side effects, like I've had, like a skin rash that was associated with it. And I think you have to speak up and, instead of just brushing it aside and being like, oh, well, because a physician's not going to know you're not comfortable or it's not working if you don't tell them. I didn't do that in the very beginning. I like I said, I just didn't want to ruffle feathers. And I think that in the long run, you're the one that has to live day in, day out with the symptoms or, with having it controlled. And so if you don't speak up, no one's going to know that you need help. It's funny, being a healthcare provider, being a dentist and working with patients all the time, when I'm symptomatic, especially in today's day and age, like people get very, I don't want to say concerned, I think concerned, like they're like, are you sick? Like, should you be working? You know what I mean? So like, it's stressful to me. Like when I don't feel well, constantly having to defend myself, which again, it's like, you feel like a broken record. You're dealing with the symptoms, but also having to explain to people that you're not contagious and it's nothing they can catch from you. And you feel like you're having to defend yourself. It's exhausting.